For my research, I'm developing strategies to support healthcare aides in their use of best practices or the most current up-to-date way of delivering care to residents in nursing homes. We're really working with the staff, with the teams, having them select an area of care that's important for them to improve, whether it be falls, pain management, whatever they select, and then developing strategies with them. It's really what's important to them, so it's not really coming in with preconceived notions, but it's taken from a checklist of what we can measure in terms of outcomes. So it is looking at nutrition or pain, what they assess on the unit, so we can look at how well these strategies might be working or might not. I came to the University of Alberta because I was interested in learning about knowledge translation science, and I wanted to work with Dr. Carol Estabrooks, who's well known in her field.
Our postdoc group right now has got 4 folks in it. We've just sent one back to Australia, one from Greece, one from Sweden, and the other 2 from Canada right now. And they come usually with one of 2 backgrounds to my program, either a knowledge translation or research implementation background, or a background in some aspect of aging or gerontological research.
In Sweden, we have nearly 20% of our population is 65 years and older. So we are ahead of Canada when it comes to taking care of older people. So making this knowledge translation in elder care, I hope I will bring some ideas and knowledge about gerontological nursing, geriatrics and so on. And I get a lot of knowledge translation knowledge from Canada and my Canadian colleagues because you are ahead of us.
The idea is to bring research into the real world of practice in long-term care setting. I think it's really significant that we have so many people coming together to focus on the care of older adults in long-term care. It's a group that's been neglected for a long time.
So Lisa is the most recent addition to the group. She comes from Toronto, a bright young woman, well prepared, with a background in studying clinical uncertainty and some other areas that make her well suited to work in the area of coaching. And coaching is an area we're exploring in terms of interventions with the workforce in long-term care. We think it's promising, and while it sounds simple to say, well, how hard can it be to coach, to actually go in and fit a coaching strategy that's doable over the long time after we're gone in an environment that's stretched for resources, that's looking after a very frail population, is going to require a fair bit of skill and thinking so that we can embed those sorts of interventions in the nursing home setting, for example. So Lisa's going to help our projects, and I hope we're going to help her develop both the ability to develop these coaching interventions as well as some of the other broader background in knowledge translation, research implementation.
It's important to get into long-term care and elder care because of the aging population, growing numbers of residents with dementia, and it really places a challenge and burden on healthcare aides who are the direct care providers to these residents. So I think it's an important area to get into and explore, and there's so much research that can be done right now to improving quality of care and quality of life to these residents. When I'm finished my postdoc, I'm not sure what university I'll be at. I want a research-intensive university, but I'm trained in Canada and I have fellowships from Canada, so I'd really like to stay within the Canadian system and improving the Canadian healthcare system.